Hello guys, my name is Victor Sosa. We are Team 4 and we have come to talk about the coronavirus. We are made of Jennifer Quiroz, Alexis Alcocer, Brenda Padrón, Valerín Martínez, Giselle López, María Santos, Gustavo Lape, Esaú Zavala, and Stephanie Rodriguez. What is coronavirus? Coronaviruses are a large family of viruses that cause disease in both animals and humans. Various coronaviruses are known to cause respiratory infection, range from the common cold to more serious illnesses such as Middle East respiratory infections and severe acute respiratory syndrome. More recently discovered coronavirus causes the coronavirus disease COVID-19. We invite you to use prevention measures. The mask is one of them. In these times, it's very necessary to always carry on wherever you go.
My name is Jennifer, and let's start. What is COVID-19? COVID-19 is the most recently discovered infectious disease caused by the coronavirus. But this virus and the disease it causes were unknown before the outbreak in Wuhan, China in December of 2019. Today, COVID-19 is a pandemic that affects many countries around the world. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, dry cough, and tiredness. Less common symptoms that affect some patients are ache and pain, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, and rash or color change in the fingers or toes. These symptoms are they usually mild and begin gradually. Some people who are infected have only very mild symptoms. Most people, about the 80%, recover from the disease without the need for hospital treatment. About 1 in people and 5 who contract COVID-19 eventually develop a severe condition and experience breathing difficulties or people and those who already have medical problems such as high blood pressure, heart or lung problems, diabetes, or cancer are more likely to develop serious diseases. However, anyone can have COVID-19 and become serious. People of any age who have a fever or cold and also have difficulty breathing, feel pain or tightness in their chest, or have difficulty speaking or moving should seek medical attention immediately. If possible, call the healthcare provider or medical facility first to refer the patient to the appropriate healthcare facility.
When the coronavirus spread, the 2019 coronavirus disease COVID-19 epidemic began in December 2019 in an animal market in Wuhan, capital of central China, Hubei province. Scientists spread rapid throughout China and other countries. And the etiology Again, is a new coronavirus CARS COVID-2, and named for the similarity of the acute, the etiology, and symptoms with those induced by severe respiratory syndrome SARS, the emerging in 2012 as the synthesis and identified that 99% suggests a very recent to the change in humans. And Howard and COVID-19 and test done through laboratory tests carried and indoor in some hospital and private laboratories certified by institution among the medical sure sample test the presence of coronavirus in diagnostic laboratories. He is ambassador of the Sukai polymers cell reaction and PCR the laboratory postal take and above 5 hours. And how many dead the COVID-19 led of October 9 and 2020 and total of approximately 1 million people have the globally, and as result of COVID-19 in Asia, the continent where red origins the death to half of our region, some 200 millions, and that in the European season the number be more than 20 million people. No, 20 million people. Specifically, there have be around that from the coronavirus in the all continent. So far, however, is no longer the continent with the recent number that from COVID-19. The figure record in American excess in 70 millions as October 19.
Hello, my name is Giselle Guadalupe Lopez Gonzalez. These are some of the doubts on this topic. How does COVID-19 spread? A person can contract COVID-19 from contact with another who is infected with the virus. This disease is spread mainly from person to person through particles that are thrown from the nose or mouth of an infected person when sneezing or talking. These particles are relatively heavy, do not go very far and fall quickly to the ground. A person can have COVID-19 if they breathe in the particles from a person infected with the virus. That is why it is important to stay at least 1 meter away from others. These particles can fly on objects and surfaces around the person so that other people can be co-infected with if they touch those objects or surfaces and then touch their eyes, nose or mouth. It is possible to have COVID-19 by contact with a person who does not have any symptoms. The main way that COVID-19 is spread is through respiratory droplets by someone who causes or has other symptoms. such as fever or diarrhea, and many people with COVID-19 have only mild symptoms. This is particularly true in the early stage of disease. It is possible to catch it from someone who only has a mild cold and does not feel symptoms.
Can we protect ourselves and others if we don't know who is infected? Practicing hand hygiene is important at all times, and it is the best way to protect yourselves and others. At all times we must keep a distance between ourselves and others. This is especially important if you are next to someone who is hugging or sneezing, since some infected people may not yet have symptoms or their symptoms are mild. Keep a physical distance from everyone if you are in an area where the virus circulates. But will show if I have been in contact with someone who has COVID. In this case, it is better to stay home, take medical help when you go to the health center, wear a mask is possible, stay at least a meter away from other people, and do not touch surface with your hands in case the parent is a child. Help him to follow this advice. If the disease is confirmed, it should be insulated for 14 days, even after symptoms have disappeared, as a precautionary measure.
What should I do if not had symptoms but I think being exposed to COVID? What does it mean to quarantine? Quarantine means getting separated from others because you had been exposed to someone with COVID. During quarantine, you should monitor your symptoms, your condition for symptoms. The goal of quarantine is prevent transmissions, because people who get sick with COVID can infect others right away. Quarantine can prevent some infections from occurring. In this case, occupy a large, well-ventilated, single room with a toilet and sink. Stay at 1 meter away from other people, including family members. Monitor your symptoms daily. Stay in quarantine for 14 days, even if you feel fine. If you have difficulty breathing, contact your healthcare provider immediately. Call first if possible. Stay positive, energetic, and exercising at home. However, if you live in an area with malaria or dengue fever, it is important not to ignore the fever. Seek medical help. When you go to the health center, wear a mask if possible. Stay at least 3 feet away from other people and do not touch surface with your hands. If a sick person is a child, help the child following this advice. What is the difference between isolation and quarantine? Quarantine means restricting activities or separating people who are not sick but who may have been exposed to COVID. Isolation means separating people who are sick with symptoms of COVID and may be contagious to prevent the spread of the disease. This is a general measure that all people should take even if they are well and have not had or are no exposure to COVID. Can children or adolescents get COVID? Research indicates that children and teens are as likely to be infected and any other age group and can spread the disease. Evidence today suggests that children and young adults are less likely to develop but serious cases can still in these age groups. Children and adults should follow the same quarantine and isolation guidelines. If they are at risk of exposure or if they have symptoms, it's particularly important to avoid contact with other people or others who are at risk for more serious.
What can I do to protect myself and prevent the spread of the disease? Keep up to date with the latest information on the COVID-19 outbreak, which can be accessed on the website and through public health authorities at the national and local level. Cases have been reported in most countries of the world, and an outbreak have occurred in many of them. Authorities in some countries have managed to slow the process of outbreak, but the situation is unpredictable. The latest news needs to be checked regularly. Is there any vaccine, medicine, or treatment against COVID-19? Will some Western or traditional medicine solution or home remedies might be comforting and relieve the mild symptoms of COVID-19. So far, no medication has been proved to prevent or cure the disease. Although it's not recommended, self-medication with any drug, including antibiotics, to prevent or cure COVID-19. However, there are several clinics that undergo of both Western and traditional medicine, with coordination work of the development of vaccines and medicines to prevent and treat COVID-19, and will continue to provide updates as research results become available. Thus, the world recommended the use of medical masks to prevent the spread of COVID-19. Currently, there is no enough evidence for against the use of masks, medical or otherwise, by healthy individuals in the general community. However, the world is actively studying the rapidly evolving scientific evidence of the use of face masks, and it continues updating its guidance on the subject.
Hello teacher, my name is Marina Santos Jorge, my group is 03M, and my team is number 1. This is my question and answers. Question number 1. How to properly use a mask? You can tell following and mine. Before touching the mask, wash your hands with alcohol-based disinfectant or soap and water. Personal disinfectant. Number 2. Inspect the mask. It's more important. Inspect the mask. Number 3. Orient the top. Number 4. Orient the correct side of the mask. Place the mask over your face. Pinch the metal strip. Cover your mouth and cheek. Do not touch the mask while you are wearing it for protection. After using the mask, remove it with clean hands. Dispose of the mask a closed container immediately after using. Do not reuse the mask. It's more important. Do not reuse the mask. Practice hand hygiene. After touching or disposing of the mask, how much time? Question number 2. How much time passes between exposure to COVID-19 and the development of symptoms? Time between exposition COVID-19 when symptoms begin is usually 5 or 6 days, but can range from 1 to 14 days. Question number 3. What is the relation between COVID-19 and animals? COVID-19 is spreading human to human transmission. We cannot allow data about others virus of the coronavirus family. Coronavirus family and most of tissue types or virus having within origins in animals. COVID-19 virus is a new virus in humans. The possibly animal sourced or COVID-19 has not yet been confirmed, but is being investigated. Finish or let's continue with my class math.
Hello, my name is Alexis Gasacoser and my question is: can a domestic animals or other animals give COVID-19? Several dogs and felines have tested positive for COVID-19 after being in contact with infected humans. Furthermore, it appears that ferrets are susceptible to infection. Under experimental conditions, both cats and ferrets can transmit infection to other animals of the same species. However, there is no evidence that these animals can transmit the disease to humans and spread COVID-19. COVID-19 spreads mainly through droplets that after an infected person cause sneezes or touch. The virus has also been detected in fire vessels, means that have later been infected with workers. In some cases, human infection means have transmitted the virus to other people. They are the first reported cases of transmission from the animals to the human being. It continues to be recommended that people with COVID-19 and exposed at risk limit contact with pets and other animals. In the handling and care of animals, basic hygiene measures should always be taken, mainly washing hands after handling animals, their food or their items, as well as avoiding kissing time, eating time leave for use or sharing food.
Good morning. Any questions for COVID-19? usual, I was fruits and vegetables. Well, the fruits and vegetables is essential for diet. Before touching them, it's very important wash with soap and water always, especially if you eat them around. Well, other question is: are antibiotics effective to prevent or to treat the COVID-19? Well, antibiotics aren't effective against virals. Only against bacterial infections. COVID-19 is caused by virus, so antibiotics don't work against it. Antibiotics should not be used as means of prevention or treatment for COVID-19. Never. It's very important. Now, in hospitals, doctors sometimes use antibiotics to prevent secondary bacterial infection that can be a complication for COVID-19 in serious ill patients. Well, be last. They should only be used to treat the bacterial infection as directed by a doctor, please. I'm sorry, other questions. Can COVID-19 be contacted with the stool of a person with the disease? Although initial investigations suggest that the virus may be present in some cases, in France to date, no case for fecal oral transmission or the COVID-19 have been reported. Furthermore, there is no evidence to date the COVID-19 virus. Some viruses in water, including wastewater.
This pandemic has taken away lives of loved ones. Let's not let it happen anymore. Let's take precautions and suffer from harm by taking care of ourselves and take care of those I love. What do you do?